I'm here from the Aesthetic Dish, and today we have a great episode. This is episode 5, and the title of our episode is "Where Did All the Male Aesthetic Injectors Go?" Tonight, I have a great group of male injectors, United States, here with me today, and I'm really excited to introduce them. My first guest is Christopher Cotto, who is a PA in Florida at Renew Med Spa. Chris, thank you. Welcome to the show.
Thank you. Thank you very much for having me, Scott. It's an honor.
Tell us a little bit about your practice.
We are a newer practice here in the Orlando area, focusing mostly in injectables, your fillers, your Botoxes, and so forth, in the community. So we've been open about officially open about a year with some change. Been injecting for about 2 years now, since we started the training. That's pretty much it. It's myself. I have my nurse practitioner. She's my business partner. So it's a male and a female owned business. And then we have an esthetician, we have a medical assistant, business development manager, and of course, in Florida, you need a medical director. So we have a medical director on board.
Great. And my next guest is Jeff Goldstein. Jeff is a PA with Elite Medical Spa in Sarasota. Has been a PA for 17 years, no, 19 years, right?
Yeah.
Thank you. Welcome to the show, Jeff.
Thanks, Scott. Appreciate it.
Yeah, tell us again about your practice.
Yeah, we are there's 3 injectors at our practice. We do everything from, Botox fillers and threads. Then we do some sexual health procedures too, with the location in Sarasota. And then we've got a location in Lakewood Ranch.
Great. Thank you. And then finally, but not least, one of the top male injectors in the United States, if not the top male injector in the United States, is Larry Blevins, who is a physician assistant who owns Plastic Surgery VIP, which is in the Orlando area. Welcome to the show, Larry.
Thank you. I glad to be here. Glad to be a part of it.
And tell me a little bit about your practice.
Well, we are a plastic surgery clinic. It's myself, and we have a plastic surgeon, a facial plastics, and then 2 other aesthetic injectors, 1 PA and 1 nurse practitioner. So we have a pretty big practice here. We're just north of Orlando in the Villages, Florida.
That's great. Well, welcome. So again, thank you guys for participating in this. This is gonna be a fun topic. So again, the topic of this show is where did all the male aesthetic injectors go? And this is a topic that's really never been engaged or embraced in any like social media way. But the concept is this, and this is kind of statistics that I just didn't really expect to find. But basically, in the United States, currently there's about 114,000 employed PAs, and currently 70% of them are females. In the nurse practicing programs, there's 183,000 nurse practitioners that are employed in the United States. 90% of them are females. And then finally, there are 3 million nurses that are employed in the United States, and 90% of them are females. And I guess I was really surprised by the statistics because I wasn't expecting that. I know a lot of great male providers that are PAs, nurse practitioners, and nurses, and yet these statistics are skewing, obviously to domination or majority of females. And so I wanted to basically start there and say, first of all, are you guys surprised by those numbers? Did you think that it's that dominant on the female side?
Well, I'll say when I went through PA school, there was only 21 of us, but I want to say there was 4 females, maybe 4 females. So that really surprises me. I know across the board when it comes to nurse practitioners, you would think because just to go through the nurse practitioner, the algorithm, you got to be a nurse to start out with. And I just find that there's never been a lot of male nurses. But so I can see how it feeds the chain for nurse practitioners. Really surprises me though with PAs. But so
yeah. How about you, Jeff and Chris? What do you guys think?
Yeah, I think the same thing. I mean, I definitely think as far as how many PAs, especially back in the day when the PA profession started, it seemed to be more male driven. And then, the latest numbers now, there's such a significant amount of females, but, maybe more females are just leading towards medicine or healthcare in general,
Right.
I've actually seen,
I think in the aesthetic arena, I understand the females being, when you go from aesthetics, when you go from whatever, say ICU or ER, where you're maybe like my last job, I did general surgery and trauma surgery, and it was about 80 hours a week. It was 36 hours on, 8 hours off, 36 on, 48 off. And then you'd start it back over. So just the lifestyle in general was difficult. And I think a lot of females move to aesthetics because they're wanting to become mothers and just get a stable lifestyle so that they can do, they're not doing call, they're not doing extra hours, no weekends. And then you can set up your schedule for, the responsibilities of parenting. I think just the lifestyle in general is a little bit more geared towards females, but just as a thought.
Yeah.
I've actually seen, so I participate in a local PA program in the Orlando area, and I do a lot of the skills labs there. And I notice a big change over the last, say, 4 or 5 years. It's been more female students than it has been males. And when I ask them, what is it that you want to end up being, or what is it that you want to focus on, a lot of them end up saying dermatology, or they want to go somewhere in aesthetics. So I've seen that trend kind of progress. When I went to PA school, it was about half and half, males and females. Now, this last time that I went to this local school, I'm going to say it's about 25% males, 75% females. And most of the females, like adding to Larry's answer, they want a stable life, and they're looking to find and make, a more secure livelihood for their family and be able to be available for them.
Sure. So it goes into the next thing that we're talking about, which is that you have a situation where the average male percentage in med spas nationally is 15%. Yet obviously, female male ratios are 50%. And the question is, how come 35% of the male population doesn't go to med spas? On top of that, statistically, men will outspend women by 13% nationally. So you would think that most med spas would want more men because they're big spenders. The largest percentage of male patients are millennials, who seem to be more aware, asking more questions. And the global market size for this is $14.4 billion, which will grow by 14% from 2022 to 2030. So it seems from those numbers that you would want more male patients, and you'd want to attract more male patients. And so I'll start with, we'll go back to Larry. Larry, do you advertise in any way to try to get more male patients? Do you do anything specifically to try to pull in male patients to your practice?
Well, I can say I'm a little bit unique. I don't really take new patients, and I haven't for a moment. But across the board, our newer providers in the clinic, no, we don't really advertise to the males. I do. I can say when I was in Orlando, I did a Botox party at the local. Remember what was the place that got shot up in Orlando? The
Pulse.
Oh yeah, Pulse. Yeah.
The Pulse. I did a Botox party there. This has been 7-8 years ago, and there was 200 people showed up. And I am not kidding when I say the average person, the average male, it was all males. The average one was like $600 worth of Botox. And then they followed up, no upselling, but then they followed up at the clinic, and it was the best clientele I had ever had. And until I moved up to the Villages, which was an hour away, I kept probably 60% of those patients.
Yeah, those guys will spend some big bucks. Jeff, do you or Chris advertise the meals?
So we do the P shot and the O shot. So the P shot's definitely advertised. We do some Botox advertisement. Most of our guys come in because we're treating their wives or their girlfriends. And so I think the interest for one of the other treatments in our spa, they come through the wife,
Right.
Yeah. piggybacking on Jeff, yeah, it's a lot of the males that we get are from the wife that brings them in. They feel comfortable. They like our med spa, and they're like, you know what? Let's. Why don't you try this? And eventually, they end up coming in. One of the biggest things I think that can help in that area is if you notice a lot of the vendor marketing, the vendors that we get, they cater mostly to females. Most of the marketing is done towards females. I think if there's a little bit of a change in including a little bit more male, or at least balancing it out a little bit, it'll increase the male confidence in coming in, getting procedures done. Not only that, it'll increase the male confidence in actually becoming an injector. It becomes more mainstream, becomes more not familiar, and they're more comfortable with that idea. I think it's something that could be included.
And I think the corporations like MERS, right, and Galderma and the other companies are starting to become aware that they need to talk about the male aesthetics, because obviously what they just recently did their recent campaign with Joe Jonas, right? That was the concept, was, Joe Jonas is finally saying publicly, look, you don't need to be embarrassed. I'm doing this, and I like Xeomin. And so I think that's the idea, is that the corporations are even getting into this. I just want to, I want to ask Larry, of the procedures out there for males, some of the procedures that bring in a lot of the males to my practice, I know that you have this at your practice as well, is bioidentical hormones, because men come in for testosterone, and then next thing you know, they're coming to for Botox or fillers. Do you see that happening with your practice?
Yeah, I will tell you that of the males that we have, a large percentage are bioidentical. And then lasers, there's a fair amount for lasers. But in general, yes, bioidentical hormones is a big plus there for the males.
Jeff, what's the most popular procedure you do on males?
Yeah, I'd probably say either Botox or laser hair removal.
Yeah.
I mean, I find that, it's kind of a mix. And again, it depends on their sexuality too. I mean, we get, that definitely, our gay men rather, they come in and they get, they like to get the fillers or lips done. Those procedures are more interested in than just Botox for your typical heterosexual male.
Yeah, Chris?
And I say for us, it's going to be your fillers and your Botox. We have a live close. The med spa itself is close to the airport, so we have a pretty large gay flight attendant population. And I still work in the emergency department to pick up shifts over there, so I bring all my nurses over. A big chunk of the population are gay males, and they come over. They feel comfortable with me, and we do certain procedures there. Though I know there's a booming interest in penile penis filler. We're not touching that area yet, but I know some guys out there have been doing some penis filler.
Right. Jeff or Larry, do any of you guys do those procedures?
No, I don't do any penile fillers, just the P shot, which I probably do about 3 a month, I'd say.
I can say for me, no, but I have definitely been looking into it recently. When we were at the conference down in Sarasota, the physician that did all the male enhancements, man, he was impressive with his work. And I find it a place, just it comes down to anytime you add a menu of service, you got to take away something. So, and right now I'm pretty set in what I do. But if I was new to aesthetics, 100%, I had this concept that I was wanting to do. I was wanting to open a male only clinic and call it like the man cave.
Yeah.
Just have just doing men aesthetics, because I can tell you that is a huge market. Huge market.
Yeah, this idea of a man cave, or that man cave environment, where you have a little scotch and cigars and some Botox and this type of stuff, this has been thought of many times before in the United States. There's a few people that have actually done it, but the thing about it, and I've always wanted to do that for my own practice too, but there's always like some things that keep me from that. We do cater to men in my practice. I have a special menu for the men. We call it the Black Book. It looks like a Playboy magazine, where it's kind of like dark on the outside. You open it up on the inside, and it has like scotch and cigars and all this stuff. So the guy feels like he has his own menu. We do a lot of male specific procedures. When Dolce Vita started, I had a urologist and a hair transplant surgeon involved in the practice early on, which brought on a lot of guys. So our population is about 28% male, which is a little bit over that average of 15%. What would you say your percentage is of males in your practices?
I would say,
go
yeah,
ahead.
sorry. I'm sorry, Chris. I'd say 15% probably in ours.
Yeah, we're between 10 and 15% at ours right now. This last month increased. So we were about 17, almost 20% of male treatments over the last the month of November.
I'm probably 5%.
5%. So you know, what we specifically go after for the guys is we go after hair transplant, we go over the hormones, we obviously get the Botox, but the other things that I feel like really guys look for a lot are erectile dysfunction medications. The P shot or pre-PIS procedure obviously is very popular. In 2010, I was one of the first students of Charles Runnels when he was starting his trainings. And I walked into a conference room. There was 42 doctors in the room. I didn't know what I was getting involved in. It was I was sent by Harvest Terumo, essentially because they wanted me to buy their machine. And I walked in, and basically there was a guy getting his penis injected. And I had no idea what the heck was going on. And I just thought, my God, this is the craziest thing. I can't even tell my staff about this. But I have to say that we've done a couple hundred cases over the last, I don't know, 9 years that we've been at it. And if you do mix PRP with fillers, you can get very, very solid results. And basically you can get some just awesome outcomes. And so it's the ability to have mixtures and composites to get good outcomes and good results. These guys, I mean, listen, they would be a line out the door if they knew about the procedure, if they knew that it wasn't going to be painful, and if they knew it would work and it would work well. But unfortunately, the hard thing I find is that you can't really market this. So, do you guys, in terms of, you said, Jeff, you did the P shot. How would you publicly market that on Instagram or social media?
Yeah, so it's usually goes hand in hand with our O shot, so or two P shots or two O shots. We call it like, couples therapy or couple, we kind of try to make it fun. But I mean, it's on our PRP menu at the spa. And then we do some individual posts on social media, about length and about just treating ED more naturally,
Mm-hmm. And with ED, the other thing is that we were offering combinations of, sometimes it's Viagra, sometimes Cialis, sometimes Levitra, but there are now new erectile dysfunction medications out there. There's one's called Adnafil, which is kind of more specific. It's less complications and risk than Viagra. And these are like new medications for me. I'm learning about these. I didn't even know this medication existed until recently. And so I've been working with compound pharmacy companies to try to get this from my practice. And I feel like that's what's pulling my guys in specifically. But to get back to another topic, we started off talking about where did all the male aesthetic injectors go? Do you guys have any idea, if you had to take a best guess at why there's not many male aesthetic injectors out there, and you would kind of blame it on one or two things, what would you guys guess it would be?
If I were to take, well, let's start off with the fact that we've had a huge decrease in just medicine, PAs, nurse practitioners, males over the last decade. It's decreasing in that area. I think a lot of them have gone into IT. I think that they've seen a huge increase in the IT sector, and I think a lot of the guys have gone in that area. To be honest with you, I think the females have been looking for something a little more settled, that they can go in and make a schedule and be comfortable. Back to what Larry said originally, but I think a lot of the guys have kind of left to that towards other sectors, including IT.
How about you, Jeff?
Yeah, I mean, I think the biggest thing is, for a lot of patients or clients, whatever you want to call them, they think that this is beauty, where we all kind of forget we're still doing medical procedures. And I think that even men that PAs, for example, even physicians, they look at this as more of a beauty, more along the lines of doing hair and makeup and injectables versus actually medicine still. So I think the stigma is definitely there. I mean, we even get called, Botox technicians. I mean, there's just a whole plethora of reasons probably, but I would say because it's along the lines of beauty that they just not interested in.
Yeah, Larry.
Well, I mean, that was very well said, Jeff. I agree with that 100%. For me, when I started, I did trauma general surgery, and I just wanted to get out of sick and injured. I just wanted to treat healthy, happy patients that wanted to just fix something that's bothered them for whatever amount of time. And I was more of like my mindset as a person, echoing a little bit on what Chris said. As a person, I wasn't more looking at it from an artistic standpoint. My mindset was more like an engineer. I enjoyed procedures where I looked at those procedures from an engineering standpoint. If I add so much volume here, what's that going to do with the vector of pull? And maybe it's just the way I came into aesthetics with a different eye appealed to me. As for what's holding males back, I agree. It might just be because it is more of a beauty industry. I just never thought of it that way myself.
Yeah.
Can I add that? Can I add that? Sorry, Larry, go ahead.
No, I was just, go ahead.
Also, the biggest monster, not monster, well, the biggest population we have in medicine is the nursing community. The majority of them are females. There's a whole CANS sector specialized meant for them to go into that sector, into aesthetics. There's not very many options for PAs to actually say, you know what, I want to go train here, I want to train here, and I want to be the best aesthetic PA and be comfortable with the idea of putting filler in somebody's face and make sure you don't get a vascular occlusion. Are you doing it right? Are you doing it wrong? Yada, 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 right? There's programs like, for example, Larry's program that he has, the AFM program. It's a fellowship that is catered, and he brings in a lot of PAs and he tries to get them out there to become good injectors and to become just overall safe injectors and do the procedures right. Not just I just left the hospital, did a weekend program, and let me go inject somebody's face and let's see what happens there.
Sure.
So I think that has a lot to do with it too. When it comes to at least male injectors itself, just to the comfortable setting to them.
My perspective, Chris, would be this. So when I became a PA, I graduated in 2000. Most PAs that I graduated went into subspecialty surgery. It was either an ortho, cardiac, or neuro, something like that. And pretty much most of the surgery people were PAs, and the nurse practitioners were doing other things like pediatrics, OBGYN, family practice, stuff like that. And obviously that's changed, over all these years. So anyways, I went into that thinking that's what I'm going to do. I'm going to do plastic surgery. I'm going to do cardiac surgery, whatever I was doing. Well, when I finished all of that, it was a natural transition for me to convert over to med spa because I had the plastic surgery training. So I don't think I would have become a PA thinking I'm going to go into the med spa environment. I think I got there because I was working in plastic surgery, and with that education training, it just seemed naturally, to go over to the med spa environment.
That's very true. And to kind of piggyback on that a little bit, and I'm not trying to bash the people that go into dermatology, but when I was in PA school, nobody wanted to go into dermatology. At least the guys, nobody wanted to go into dermatology. The first thing they thought was, or anything of that sort. They said, oh, they're not going to be able to learn as much. They're going to be limited. They wanted to go into cardiothoracic surgery, ER. That's where most of the guys wanted to go to. So, it's kind of, I like the fact that we're having this podcast to kind of open up the idea of like, guys, there's great things out there in the aesthetic industry for us too.
Right. That's the point of this thing, is that there's, for all those guys out there who are nurses, nurse practitioners, or PAs, there is an incredible career in this. And we wish you would help join us and participate, because obviously we've been good examples of how you can be successful, owning your own practice and running your own practice and doing aesthetics. And so it's great. So I'm going to get into the next segment here. We'll just do a couple of quick questions. They'll be kind of funny, but we'll kind of say this tongue in cheek. But Jeff, do you think that males inject differently than females?
I think males inject males slightly differently than females inject males.
All right, wait, I'm gonna say that again. Males inject males differently than
Confusing myself. No, I think so I've had PAs, all females in within our practice, and I find that sometimes I have to reiterate, we got to, men notoriously have just strong facial muscles, and females I feel are a little bit scared of dropping their brows, and I'm like, you guys inject me, my brows never drop. You just got to hit them, otherwise I'm going to Spock. So I feel like, and not all females, but some females are very scared to aggressively inject a man to get rid of the wrinkles.
okay. How about Larry? How about you? Do you think there's any differences?
Maybe just in the approach. I think females will come at a consultation from a different point of view. Maybe, as Jeff brought up earlier about coming from a beauty standpoint. I think I look at it maybe just at a different point of view, just from the consult. But when it comes to injecting, no, I don't see a big difference in it. I do agree with males. You do have to use more, and whether it's volume and or neuromodulators, but I don't see a big difference in the techniques. That's kind of across the board. And we do know that little things like, the bimalar width on a female, you want wider than the bigonial width. On males, it's more even or a little bit wider in the bigonial width. But other than that, I don't see a big difference when people that come through here are training, at least.
Chris, you own your practice, and you said you own it with a nurse practitioner. Is that right? Is that what you said? If you were having an interview with a bunch of males and female nurse practitioners, PAs, nurses, would you be more likely to hire a male versus a female provider?
To be honest, I think having a good balance of both from a business standpoint, I think it's smart. I think you attract a wider clientele, a wider patient population than just sticking to just one. I know a lot of med spas out there focus on just in areas, a lot of offices on just bringing in just only females. I think they're missing out on a big chunk of a patient demographic by just doing that. So I think spreading the love, it's all about balance in life. And I think the same thing goes to business.
Yeah, I completely agree with that, because in my practice, we have 9 injectors, and so I'm the only male, but there's the rest are female. But my point is that, for example, the young patients we have want to talk to young providers. Sometimes the males want to talk to me. They don't want to tell a young 20-year-old millennial gorgeous girl how small their penis is or how bald they are. They're very they just don't have the confidence to do that. That's why they're there. They're embarrassed. And so I feel like if you have different types of providers, like people that are older, people that are younger, males and females, you're hitting all of the groups of patients that are coming at you. What about you, Jeff? How do you feel about that?
Yeah, I agree with both of you guys. I mean, just like, all of our injectors, they do lips slightly different. And if you're wanting that Russian lip technique, I say you got to see Farah. She's mastered it. She's good at it. But if you want a more natural, filler or lip enhancement, rather, you're going to see another provider. So I do think variety is great, just like with injectors with certain procedures or whatever the case is. I definitely think also that, I mean, you want to have some variety within your business also.
Larry, in the world that we're in now, where it's like the Me Too kind of woke culture type of stuff, do you always have female attendants with you in the room? Like, do you have to do that in your practice? Like, for example, in my practice, and unfortunately, every time I go into a room, I always feel like I have to have a female attendant in the room. How about you?
I know when it comes to body contouring, yes, of course, but that probably makes up 15%, maybe 20% of my practice at max. But so when any body contouring, yes, but when it comes to facial aesthetics, not. My demographics are different. Probably 90% of my patients are baby boomers, which is a little bit different than your average aesthetic Gen Z or millennial that's out there now. So I do think based on location and your demographics.
Yeah, again, I've been to your place. It's an incredible place. Anyone ever have a chance to spend time with Larry, go do it. He's incredible, a great educator and a great location. But when I was at his place, he basically has a bunch of women who are in their 50s, 60s, and 70s who basically just are in absolute love with him. And he walks in the room and has like literally their full attention. And next thing you know, they're getting pan volumized left, right, up, and down. So I've seen him in action.
Well, I appreciate the kind words.
Well, like I said, it's great. So Jeff, I want to get into the next thing here, which is and we talked about a little bit about how there's not a lot of male injectors, and we all know each other because we've all been part of the Dolce Symposium that we've had in the past, where it's like an educational symposium that we all get involved in to learn threads and fillers and injections and things of that nature. And I've always been a big person who's advocate of teaching and aesthetic education. We trained like 1,200 injectors over 4.5 years with that type of idea in mind. But what I'm seeing now is that there are female only training events that are occurring in the United States. These are designed to make women feel comfortable and to have a comfortable environment of education. But these training events basically require that you can't be a male to attend. And they are training for the same things that I train at my Dolce Symposium, like threads or filler or toxin. Do you think that it's fair that there are these events that are female only? Do you think that it should be open to all genders? I mean, do you think it's important that they have a safe environment like that? What's your thoughts on that?
Yeah, I mean this is the first time I'm hearing of this. I mean, which is crazy to me actually. So I mean, I think it's nuts. I think that there shouldn't be any gender only training programs. I think all these programs, regardless of who's training, should be open to everybody. So they can learn and just learn like everybody else. I don't know how much privacy they need though, or what's the point of the privacy? Is it for so they can ask specific questions, or is it learning certain techniques that they only want certain people to learn? It kind of doesn't make sense.
Well, one of the events is like a sleepover, and so maybe that's why. And then the other one is like it's like a yoga retreat. So maybe they don't want me there in my pink tight spandex, like in the front, passing gas at yoga retreat. I don't know, but they don't want me there.
That's a sight to see. I love it.
I'll tell you a quick story. TJ Sai, you might know him. He's a big injector in California. He was invited to one of these events, and he was so excited to go. He was going to be an educator and a teacher there, and except that when he got there, someone said to him, "Wait a minute, I thought you're gay," and he said, "No, I'm not a gay." And they said, "Oh, well, you're not supposed to be here." And so basically,
Wow.
yeah, he was so he didn't know what to think because he didn't know if he should be insulted because they thought he was gay or the fact that they're telling him that he can't speak because he's not gay. But anyways, yeah, that's basically a
It
true
is.
story.
Wow.
Yeah,
That's a tough
yeah.
one.
So Chris, how do you feel about it? What do you think? Do you think we should all have fair play, or do you think that there should be like specific male, female aesthetic educational events?
If it's a sleepover, I guess I'm not sure if it's because of the women's safety or exactly what it is. Other than that, no, I think it should be fair play for everybody. At the end of the day, the minority in this field is us, males. So why are we getting? That's another area that we're getting kind of, I call it cheated on, but we should have an opportunity to learn. We're out there. There's guys out there that want to learn and do things right. Why are we not supplying that education to everybody? It's
Right.
it's to make everybody a safe injector.
Larry, back to you. I was trying to think of any undiscovered male, procedures that don't exist or that are not popular or not like in most med spas. Did you think of anything specifically that, may come up in the future, or a new technology or new procedure for males that may become popular in a med spa environment?
Yeah, I've got some really big ones that I've been working on for a couple years now, and it just body contouring, like muscle enhancements, like with or not neuromodulators. Well, you could use some neuromodulators, but using HAs and radius. I think body contouring is going to be really big in the future.
That's awesome. Do you guys? I don't even know if you guys remember this. But do you remember the guy named Justin who was like a Ken doll who has the implants placed in? He was always out with the aesthetic shows in the
Yeah,
past.
I
Yeah,
remember.
Yeah. Oh yeah.
yeah. But but in your situation, Larry, you're talking more about fillers, like fillers to induce the musculature structure.
Well, I had this, it was probably 8 years ago. I got this name around Central Florida for they have a lot of these body competitions that'll come to Orlando, the nationals and the regionals or whatever. It seems like every weekend there was a big fitness event to where, women are down to 18, 16% body fat. And, they've lost all the volume. So we're adding back volume in the face. And then when it comes to, maybe whatever muscle, you could go in and enhance the muscle to get it to stand for and I can say, me personally, I've got a couple state and national champions that I feel like I was a good part of that. So I think that's going to be a big future.
That's great, Chris. How about you?
What I've seen, right now we're not doing any body contouring at my place, but what I see is a lot of well, for Larry's sake, it's going to be definitely HAs because right, they don't have any body fat, but I've been seeing a lot of body sculpting with fat. So that's something that I think is upcoming, and it's going to be a little more mainstream coming up. It's already happening. If you look at some of these guys doing it on Instagram and you follow them, increasing their pecs, increasing their biceps, their calves. They call it, what is it, the soccer butt on guys?
Yep.
So the soccer butt and all those things. So I think that's probably, it's going to become a little more mainstream, and that's something that's going to be around here for the future.
How about you, Jeff?
Yeah, same thing. I think the body contouring, I think there's so much more, with the different makes of different fillers and whatnot. I think there's so much opportunity for that stuff. I think, yeah, if you could do anything non-surgical, I mean, I think, that would be something that would be great. And I know tons of clients that would want it.
I know it's a strange thing to say, but I feel like ears are one place that we don't focus enough on guys. Guys always have wrinkled ears. They always have like loss of volume in the ears. So I like to put a lot of filler and Botox in the ears, and everyone looks at me weird when I do that. But I don't know. I seem like all these guys that they have their wrinkled ears and it bothers them. They're like they don't care about all the wrinkles in their forehead except they care about their ears. So it's kind of a weird one.
That's a weird one. And then the preauricular area for males, I don't know why they get that creping there.
Yeah,
Really
that crepiness. Yeah.
yeah.
There's a new procedure now. Well, it's not new. It's been around where they take little they're mini biopsy kind of holes. Not really a biopsy, but they excise little pieces of the skin
Yeah,
and
the
then let it
core.
grow around. Your coring. There we go. Thank you.
Yeah.
Coring.
Yeah.
That's up and coming too.
Yeah.
Larry, sorry to cut you off. Larry, what do you think, kind of as a final question here, what do you think we should do to get more males into the male aesthetic industry?
Look, when you brought up the question earlier, if you were hiring, would you pick a male or a female? I personally would pick a male. I just find I don't know maybe it's my demographics, but I feel like they feel more comfortable. It's kind of an odd one for me to even say, but I think there's a lot of opportunity for males in aesthetics. I really do. And even if you just did men only, or if you just got into aesthetics, I just don't think they understand. When Chris brought up, the most difficult thing about aesthetics is how do you get into it? You're either, I can't hire you unless you got experience, but you can't get experience unless somebody gives you a chance. And I think with males, they want to just, they've spent all this time to get through school and they just want to stay on a path that's least resistance, easy to get into, easy to work, have these mentors over them. We were talking earlier, I have a PA flew in from my second IPAP, the military PA, he came from Utah. And we were just talking about in general, when you're in a training program and there's somebody standing over you, like I would do that, I wouldn't do that, hold off on that, make sure you do this, you feel comfortable. But what's happening in aesthetics now is everyone wants to get into it, but there's no real good training programs out there. And so they find themselves just open up their own little shop and start working. And then they get overwhelmed because you don't have that support around you. So I think for males in general, if they just got in and saw what the industry was like, I think we would have a lot more men in aesthetics myself.
Yeah. How about you, Jeff?
Yeah, I think, I definitely agree. Like down here in Florida, we don't have, I mean, the regulations are a little screwy, let alone, with who could be, the supervising and, supervising the medical director, whatever the case is. But then you've got, where in other states where nurses are injecting. So there's a lot of rules just in general, I think, that are not consistent through the United States, let alone just Florida. So I think that we need to really build up on that first. And then I think you're right. We definitely don't have good training programs. I trained a PA who came from the ER, all the way from doing tox. She's now seeing 30 patients a day, threads, you name it. And she's a workhorse. It's a lot of time. So unless you've got a dedicated training center, it's so much time. And who knows if they're all going to make it through your program. But I do think, I think, I got into this because I love procedural work, and I did that in the ER when I worked. And so I thought, hey, I don't really think of this as beauty either. I don't even care about beauty really. I just like the procedural work, and I look at it like a little bit, just that it's a way of making someone look better. I don't care about their blush and hair color.
Jeff, you don't care about it because you're beautiful.
I don't know.
I saw
Maybe.
Jeff at the Joe Jonas Z-Man launch campaign in New York City on the we were in the Boom Boom Room, and Jeff, he was like the star of the whole place. Everyone was around him. They were like, "Who's this guy?" He was like the life of the party.
I don't know about that. I've never met anybody there, so I think that's why everybody was paying attention to me.
Yeah, you might not remember much of it. That maybe that's the thing.
It's probably best.
Yeah. So we'll end on this. So Chris, and we'll move forward to the rest of you guys. Why don't you end up with some closing remarks about one, how you feel about like I said, trying to gain more males into aesthetics, and two, just any comments you have about about the industry in whole and things that you might want to see for the future for the industry, whether that's related to the males or not. Starting with you, Chris.
Yeah, so I think the first thing is, back in the days, just like Botox was almost taboo, only certain people can get Botox. Now it's very accepted by everybody, just about. I think that trend is happening with males. It's just moving a little bit slower. I think if our vendors, like I said before, can increase the marketing in that area, that'll push the male market a little bit faster. When it comes to training, programs like what AFAM that Larry offers, which, by the way, I will be his fellow coming up in January. I'm super excited about that, to learn more about the aesthetic world. If there were more training programs in that area, I think the more males will actually join in, and knowing that there's some security behind it, not just open up and see what happens.
Chris, you know how much of an honor that is to be in that program, right?
Oh, I'm super. It's a great honor. I'm humbled. I'm humbled to the end.
Did he tell you about the part where they wake up at 4 o'clock in the morning and do marches around the villages?
I think he's waiting for January for that one. I think he's hiding that one from me. He's like, he didn't put that one in the application.
Yeah, you march around villages looking for pineapples.
That was it. Looking for pineapples.
Jeff, what's your thoughts?
Yeah, going on the villages, man. I used to do joint injections in the villages for this group way back in the day, and man, they are very active as far as their joints. I can only imagine everything else. Yeah. So I mean, I agree. I think our training, that there needs to be more training. There needs to be more standard training. Maybe it's going along with what the RNs do with the scans. That there is a standard, so it's like a standard of care, because there's really no standard of care. But I think more men, I think if they want to shadow, get them in your doors, because I think once they see it, that it is, you're doing your own thing. You're not working like necessarily like a doctor overlooking everything, but at the same time, the PA can make their own decisions and make these people feel good. I think it's just another world of medicine that they're missing out on.
And Larry, how about you?
Well, I've got a lot of thoughts when it comes in general about, whether it's males moving in. I don't think they understand how, like, just the life of an aesthetic provider. First off, you kind of make your own schedule so you can actually do that you could follow Scott Callahan and work 11 to 3:30 and still make more than all of us. But you can set your own schedule. You can live your own life. You don't do weekends. You have very, very few emergencies. I think the lifestyle and then income in general, I know that, you have more opportunity to make 3 times the income of any other specialty in aesthetics. We were talking today, and I think I'm always telling people if you want to be a good aesthetic provider, it's about 5 years. If you're really attentive to what you're doing, how many units you put, how you placed it, you do good photographs, and then you follow up, whether it's a phone call. Like I'll usually take a picture of where I'm going to inject, and then I'll text them the picture, tell them in 2 weeks I want you to send me back the same pictures. If you really analyze it and study what you do, you're very attentive, you might make it in 3 years, but it's a good 5 years. But then the question was asked to me today, what's the most important aspect in the character of someone that's going to make it in aesthetics? And I think it's just truly like eagerness, like want. We had probably 15 applicants for our fellow in the spring, and Chris himself was just the most eager. And when you're teaching someone, you want someone that's just like, I'm in it. Like when we went through PA school, there was not I didn't want to become a nurse practitioner, didn't want to become a nurse, didn't want to become a doctor. I wanted to be a PA. There was not another option for me. When people like the fellow that's here now, Stephanie, she went to nurse practitioner school and literally in school said, I'm going into aesthetics. I'm just here to get the piece of paper. And I find that someone that they know who they want to be, know what they want to do is the most important characteristic of someone to make it. As for males, I think they just don't know what's out there. They don't understand that how like I think it's just cultured maybe a little bit more with females, like Jeff said earlier, with just growing up in beauty and aesthetics, and men we think more procedural. But I think if men would open their eyes to aesthetics, they would move over in droves.
Again, and I agree with all of you guys. You have all great points. I am so surprised that men are in droves, in aesthetics. I mean, what's to hate? You have an industry full of beautiful people, right? Where you make a fortune of money. In my guesstimate, you can make essentially the same that you would make as a 30-year surgical PA as you would in 10 years in aesthetics, right? I mean, my father, who was a PA before me, worked 35 years as a cardiothoracic PA. And in 5 years, I've made more than he'll ever make in his entire career. I mean, and more importantly, I'm doing what I love to do, right? Making people feel beautiful. I'm not in the OR or in the hospital with people dying in my hands, doing central lines and chest tubes and, emergency stuff. I mean, I can't understand why there wouldn't be more men in this. It just doesn't even make sense to me. And maybe it'll just the fact that maybe we're just the 4 smartest guys out there. That might be the possibility, right? I mean, we just might be the luckiest son of a bitches in that's basically the bottom line.
I agree.
Yeah.
Well, again, thank you so much for participating. I really appreciate your feedback. Chris Cotto, Jeff Goldstein, Larry Blevins, all from Florida, 3 really great injectors. On the podcast, we'll put their handles so that you can go follow them and go to them for procedures. And thank you guys for checking into our podcast today.